Have you ever really thought about what's going on inside your body when you break a bone? It's so much more than just, slapping on a cast and waiting it out. It's this incredible, complex, and honestly kind of weird biological process. So today, let's dive into this invisible world of how a bone actually mends itself. And we're going to start with a bit of a medical mystery. How on earth is it possible that a brand new fracture can be totally invisible on an X-ray, only to show up clear as day a week later? I mean, that feels completely backward, doesn't it? Well, stick around because we are definitely going to solve this one.
But first things first. To solve that mystery, we really need to get a handle on the basics of what a bone break even is. So let's get our key terms straight.
We're going to be focusing on a specific type called a stress fracture. Now, this isn't your typical break from one big fall or accident. No, this happens because of a mismatch, an imbalance really, between how strong a bone is and the repeated, chronic force you're putting on it. And as we're about to find out, there are two very different ways that mismatch can happen.
So, let's open up the fracture files. Think of these as the different personalities of stress fractures. And knowing the difference between them is absolutely crucial to understanding why they happen in the first place.
Okay, so this brings us to a really important distinction. On one hand, you've got a fatigue fracture. This is what happens when you have perfectly normal, healthy bone that's being put under abnormal levels of stress. On the other hand, you have an insufficiency fracture. And here, the bone itself is abnormal or weak, and it breaks under just normal, everyday stress. See the difference? Abnormal stress on normal bone versus normal stress on abnormal bone.
The source material gives a pretty memorable picture for a fatigue fracture. Think of that super dedicated, high-achieving cross-country runner who just pushes their perfectly healthy body way past its limits. That right there is abnormal stress on normal bone.
And for an insufficiency fracture, the scenario is just as vivid. Picture an older person with osteoporosis, where their bones have lost a lot of density. They're not doing anything crazy, just walking down some steps. But because the bone itself is abnormal, that totally normal stress is enough to cause a break. We also have to give a quick mention to the open fracture, which you might know as a compound fracture. Now, this isn't a whole different league. This is any break that's tied to an open wound, where the bone is actually exposed. And the biggest worry right away isn't just the break itself, it's the huge risk of infection.
All right, so now that we know the different characters in our story, let's get back to that mystery. How does the body's internal repair shop actually fix these things? And why in the world does that process make an invisible fracture suddenly visible?
Well, the healing process basically happens in three main stages. You've got the immediate inflammatory phase, then the reparative phase where the body starts building new tissue, and finally the long-term remodeling phase. But look closely at that sweet spot, 7 to 14 days. That little window right there, that's the key to everything. Let's just focus on that for a second. 7 to 14 days. What on earth is happening during this specific time that completely changes what a doctor can see on an X-ray? And here it is. This is the answer. In that 1 to 2 week window, the body's little repair crew comes in and starts clearing away the debris, the sharp, dead edges of the broken bone. This cleanup process, called resorption, actually makes the gap at the fracture line a little bit wider for a short time. And that is why it suddenly becomes way more obvious, darker on an X-ray. The healing process itself makes the injury easier to spot. This whole biological quirk leads to a classic piece of medical advice. The source jokingly says this explains the common disclaimer to consider a repeat X-ray in 7 to 10 days. So when a doctor thinks you have a fracture but can't see it on day 1, they're not just being cautious, they're letting biology do its thing and reveal the truth. So once it's spotted, how long does this whole healing thing take? Well, it really depends. It varies a lot. The little bones in your fingers and toes, they're pretty quick, maybe around 3 weeks. Most other bones, you're looking at about 6 to 8 weeks. But a big, heavy-duty, weight-bearing bone like your tibia, your shin bone, yeah, that could easily be 10 weeks or even more. But of course, what happens when the body's repair shop runs into trouble? The process doesn't always go perfectly, and it's pretty important to know the language for when things go off the rails. There are really 3 main terms here. A delayed union is kind of what it sounds like, it's just taking way longer than expected. A non-union is more serious. That means healing has just stopped and it's not going to finish on its own. And then you have malunion, which means the bone healed, but as the source so memorably puts it, it healed all crooked as a politician.
So what things put you at risk for these problems? Well, some you might guess, like a vitamin D deficiency. But check out some of these others.
Tobacco use, whether smoking or chewing, is a huge one. And this might surprise you. Really common medications like NSAIDs, think ibuprofen, and steroids like prednisone can actually get in the way of your body's ability to heal bone properly.
You know the old saying, location, location, location. Well, it's true for real estate, and it's definitely true for fractures. Some breaks are in these anatomical hotspots that are just naturally difficult to heal because of the forces that are always acting on them.
To really get this, we need to think about two opposite forces. On the compressive side of a bone, the forces are always pushing the broken ends together. That's fantastic for healing. But on the tensile side, the forces are actively trying to pull the bone apart. And, as you can probably guess, that makes healing a whole lot harder.
And this brings us to a really notorious example. A stress fracture on the anterior or the front of your tibia, your shin bone, that's on the tensile side. It's constantly being pulled apart. This fracture is so bad at healing that it's earned this really ominous nickname among doctors, the dreaded black line.
So here's the bottom line, all summed up. High-risk fractures, like that dreaded one on the anterior tibia, are almost always on the tensile side, where forces are pulling things apart. The low-risk fractures, they're usually on the compressive side, where those forces are actually pushing the bone together and helping it heal.
So we'll end on this thought. Bone healing isn't just something that kicks in after a big injury. Your bones are in this constant, dynamic state of breaking down old bits and rebuilding new bits every single day. And the really crucial thing to realize is that the same stuff that affects healing a major fracture, your nutrition, medications, lifestyle choices, all of that is also affecting that daily repair process. So the real question is, what are your choices doing for your bones today?